Hello, listeners. Our today's episode will be all about the diabetes, India's silent health crisis, which is continuously exploring. Today, let's talk about a health crisis that's impacting millions of lives quietly but seriously diabetes. This problem goes far beyond individual health crisis. It is reshaping the economies, adding the stress on the families, and changing the very structure of our society. In India, especially, diabetes is a huge issue affecting our economy, social lives, and affecting our economy productivity, which makes it critical to understand this in detail. To start, it's important to know what diabetes really is. Think of it as a condition where the body struggles to manage sugar levels in the blood. Usually, our blood or body relies on a hormone called insulin to help the process sugar from the food we eat. In diabetes, either the body doesn't produce enough insulin or can't use it properly. This results in high blood sugar levels, which can lead to long-term health problems like the heart disease, kidney damage, as well as blindness. Globally, diabetes has become a crisis nowadays. In 1990, about 63 crores people worldwide were living with diabetes. By 2022, this number had increased to around 83 crores. Yes, by 20 crores, the number of people suffering from diabetes has increased. This rapid rise shows just how serious the problem has become worldwide, especially in the low and middle income countries like India, where healthcare systems are often already under pressure. Now, we can see that there are so many ads going out about the sugars, but still we can see that the diabetes main concern is about the sugar, the main reason why the people are suffering nowadays. What's even more alarming for us in India is that we have the highest number of people with diabetes in the world. This is a very bad data for India. In 2022, roughly 21 crores adults in India were living with the diabetes. That's over 15% of our population. Don't you think this is a tremendous work which the India is doing, or basically the worst scenario which India can expect? What's even more worrying is that diabetes is now affecting younger people at a growing rate. If you are a 20-year-old woman living in an Indian city today, you have a 64.6% chance of developing diabetes during your lifetime. If you are a young man, your risk is also quite high at 55.5%. Even for those who reach the age of 40 without diabetes, the chance of getting it remain high, about 59.2% for women and 47.3% for men. This shows that diabetes is no longer just a disease for the older people. It's impacting young adults too, creating new challenges for the future. India's diabetes crisis is even more severe in urban areas. City life often means eating more processed foods, sitting for long hours, as we can see in our jobs, that we are sitting at one place for continuously long hours, and dealing with high stress, which our boss, our managers give us on a continuous basis. And also because of the processed foods, we can see in the urban areas where the people have left their home and they are living in the urban areas in Delhi, Bombay, Bangalore. They are continuously eating the processed aloo parathas or the different foods which are available nowadays. They are having a huge impact on our lives. In cities, about 18.5% of people have diabetes compared to 14.9% in the rural areas. Because often in rural areas we can get the organic food. But in urban areas, there is mostly the business going on of the processed foods. The southern states of India, such as Kerala, Tamil Nadu, Andhra Pradesh, and Karnataka, have particularly high rate of diabetes. This is partly due to the diets heavy in carbohydrates and sugar along with the less physical activities. It has always been said that the physical activity, yoga, is very much important for us. But because of the current lifestyle, we can see that India is leaving all the hopes of doing the yoga and maintaining their fitness style because of the pressure which our boss or our managers are giving us, because of the work which we are doing. For example, over half of the households in Kerala have at least one person with the diabetes. By contrast, only 25.3% of households in Rajasthan deal with this issue. States like Karnataka also report high rates driven by similar factors, while southern states often have better healthcare facilities, meaning more cases are diagnosed. It also underscores just how widespread diabetes has become. A major challenge in India's diabetes crisis is the cost of healthcare. Less than a quarter of Indians have health insurance. It is very sad to know this. Even after the government is continuously promoting the insurance policies, our India is not taking the insurance policy. Less than a quarter of Indians only have the health insurance, which means most people have to pay for their healthcare out of their own pockets. And obviously, they are reluctant to pay for the health insurance and they do not go to the medical offices. On average, diabetes care cost around 15,535 per person during the year. A heavy burden for many families because India is having the large number of people who are living under poverty. And this estimate might even be on the lower side since healthcare costs are rising on a faster rate. The problems gets even more complicated in the states which are having the limited access to the healthcare. For example, you can see all the states which are on a developing stage, which are not so much developed, like Bihar, Uttar Pradesh, and Madhya Pradesh, where insurance is comparatively very low. The insurance coverage is also very low. This makes it difficult for many people to get the care they need to cure for these diseases, like the diabetes. On the other hand, states with better healthcare infrastructure, like Chandigarh, is top on it. Goa and Delhi have high awareness and better treatment rates. But still, the habit of eating more and dealing with the diabetes is more in these areas as well. Even though the healthcare facilities are good, so this way they are coming up to the mark wherein they can deal with this situation. One of the most concerning issues is the lack of awareness about the diabetes. As you were also not aware that the diabetes is failing so much, so you were also aware. But now, after today's episode, now you are having the idea that yes, the diabetes is a concern for the India nowadays. Around 27.5% of people with diabetes don't even know they have it. This means millions of people are living with a potentially dangerous disease without knowing it. Only about 21.5% of those with diabetes are receiving the treatment. And what about the remaining 80%? They are left behind. They are not taking the treatment for it. And fewer than 7% manage to keep their blood sugar levels under the control. Without awareness, there can be no treatment. And without treatment, diabetes can lead to serious health problems. Untreated diabetes can also cause the heart diseases, kidney failure, nerve damage, and even blindness. The gap in awareness is especially wide in the rural areas because rural areas often assume that how they can have the diabetes. This is a common concern which is going on in urban areas. So how the rural people are even affected for it. But this problem is going on over there. Next thing, the gap is awareness especially wide in the rural areas and among the people who are there with the lower incomes, who often have less access to the information and healthcare. Interestingly, wealthier people are about 10 to 12% more likely to know about their condition because they do the health checkups and also they get the treatment for it and they even manage it better than the poor people. Gender also plays a great role over here, with women often being underdiagnosed and untreated due to the social and cultural factors. Diabetes doesn't just affect people's health, it has a huge impact on the economy too. On the economy side, if we see how it's impacting our economy, in the United States, diabetes cost an estimated $412.9 billion in 2022, including both direct costs like medical bills and indirect costs such as lost productivity. In India, even though healthcare costs are lower, this impact is still very serious. For example, the yearly per person cost of diabetes care is about 15,535 rupees, which can be a big financial burden for many lower income families. If we see our per capita income, or even if we see the wage rate which is going on in India, comparatively 15,535 rupees is a big chunk for the poor families. But direct costs only tell part of the story. Diabetes also reduces the productivity as people often have to take time off work or aren't able to work as efficiently if they are having the diabetes problem. Back in 2017, the estimated productivity loss due to diabetes was worth 176.6 lakh crores or roughly $2.6 trillion. This loss came from missed work days, reduced work efficiency in the work, and early retirement caused by complication from the diabetes. So don't you think that this is a serious problem for the country? The economic impact is especially concerning in a country where many families are still trying to achieve financial stability. They are trying to go out of the poverty. Unfortunately, a lack of reliable data makes it hard for the country to measure the full scope of the problem, showing the need for more focused research. To address the diabetes, we need a large-scale systematic approach. Public health campaigns that raise awareness about diabetes and its risk factors are very much essential to cure this disease. Expanding insurance coverage, also introducing early screening programs could help the catch diabetes before complications develop. Because at a later part, this is a strategy or this is a disease which is same like a cancer. Simple lifestyle changes like adding a few extra minutes of exercise each day or reducing time spent sitting can make a big difference in blood pressure and overall health. Even small changes such as walking or cycling for an extra 5 minutes a day can lower the risk of the diabetes. And this is very important for our country, where the work stress is continuously increasing and all the people in the bank sector or any of the sector, they prefer sitting jobs. Now, Countries with better awareness and treatment rates like the US offer valuable lessons. By promoting lifestyle changes and building stronger healthcare systems, we can make significant strides in managing diabetes. Diabetes affect not just the individuals but entire families. When someone in a household has diabetes, everyone feels the strain financially, emotionally, and socially because we are connected to our family members. Even the 15,535 rupees for a poor family, this is giving the financial load for them. And emotionally, we are also get affected if our family members are dealing with the diabetes. Families often have to prioritize healthcare costs over other basic needs, and the stress of managing a chronic condition can weigh heavily on the mental health as well, impacting both the persons with diabetes and their loved ones. Unhealthy habits within a family can also increase the risk of diabetes for future generations. This makes diabetes more than just a health issue, it becomes a social issue that affects family life and can even lead to health risks for children down the road. Simply put, diabetes is a silent crisis with serious consequences. It's a health challenge that impacts our economy, workforce, and society as a whole. Those who feel the impact the hardest are often the most vulnerable, like low income families and people in rural areas. Without better awareness, improved healthcare access, and proactive policies, the crisis will continue to worsen, and each and everyone should take the step for the awareness program on this. This episode was to concern about the awareness and give you the data how this disease is continuously going on. By focusing on education, preventive measures, and better healthcare, we can tackle this epidemic head on. It's not just about treating an illness, it's about protecting the future of our family, workforce, and our country. If you have liked our video, do share it with your friends and give them this information and like our video and subscribe to our channel. Thank you.